With prescription drug prices continuing to rise, the Trump administration is reaching across the border for a solution. It is clearing the way to import some lower-cost medications from Canada. But as CBS 4's Katherine Johnson tells us, relief for consumers might still be a long way off.
The Trump administration says it is open to having low-cost prescription drugs come into the United States from Canada.
We think there's a real opportunity here where they can manage bringing drugs into the United States from Canada in a way that does preserve the safety of the American system.
Health and Human Services Secretary Alex Azar announced states, wholesalers, and pharmacies can now submit plans on how they would import certain drugs from Canada that are versions of FDA-approved drugs.
For decades, the response here at FDA and HHS has been, it can't be done. It can't be done. Don't send us your plans. Now we're saying, we think it can be done.
Skyrocketing drug prices are a big concern on Capitol Hill.
The drug costs more than my car payment, more than my business insurance, more than my food bill each month.
And on the campaign trail.
How can that be that in the United States of America that I am paying so much for insulin?
Cancer patient David Mitchell is the founder of Patients for Affordable Drugs.
This is a step toward using importation to provide relief for some people who are struggling with their drug prices, but it is not a solution that will help all of us because it's very limited in its scope.
The plan still has to go through the regulatory process and could face court challenges from drug makers. The head of the Pharmaceutical Research and Manufacturers of America issued a statement calling the administration's importation scheme far too dangerous for American patients, adding there's no way to guarantee the safety of drugs that come in from outside the U.S. Katherine Johnson, CBS News, Washington.
Now, certain classes of drugs, including intravenous drugs, are excluded from this program.